Academy for Competitive Exams. Welcome again the PGTRB aspirants, the TRB aspirants, TET and CTET aspirants to the practice test number 13 post, that is MCQs with immediate answers. Dear viewers, we can expect the Tamil Nadu PGTRB examination in the last week of January 2022 or in the first week of February 2022, subject to the provisions of corona restrictions. Now let us go into the content. Question number 1, practice test number 13 on the topic educational psychology. Which drug or chemical helps in a person carving attitude towards alcohol? Which drug or chemical helps in a person carving attitude towards alcohol? The given options: option A, disulfiram; B, naltrexone; C, Valium; D, lithium. Again, I repeat the options: A, disulfiram; B, naltrexone; C, Valium; D, lithium. Which drug or chemical helps in a person carving attitude towards alcohol? The right answer is option B, naltrexone. Option B, naltrexone. Question number 2. Failure to recall previously stored personal information is known as. Failure to recall previously stored personal information is known as. Given options: A, somatoform disorders; B, phobia; C, dissociative amnesia; D, none of this. Failure to recall previously stored personal information is known as. Given options: A, somatoform disorders; B, phobia; C, dissociative amnesia; D, none of this. The right answer is option C, dissociative amnesia. Option C. Moving to question number 3. The Rorschach ink blot test is best identified as. The Rorschach ink blot test is best identified as A, a projective intelligence test; B, a projective personality test; C, an objective intelligence test; D, an objective personality test. The right answer is option B, projective personality test. Rorschach ink blot test is best identified as a projective personality test. Option B. Moving to question number 4. The most commonly used test for measuring adult intelligence is. The most commonly used test for measuring adult intelligence is. Given options: A, WISC, that is WISC; B, WAIS, that is WAIS; C, HRSD; B, BPRS. The most commonly used test for measuring adult intelligence is. The right answer is option B, WAIS, that is WAIS. WAIS. Option B is the right answer. Moving to question number 5. Who is the father of behaviorism? Who is the father of behaviorism? Given options: A, John.B.Watson; B, Pavlov; C, Skinner; D, Bandura. Who is the father of behaviorism? Given options: A, John.B.Watson; B, Pavlov; C, Skinner; D, Bandura. The right answer is option A, John.B.Watson. Option A. Moving to question number 6. Parkinson disease that results from the death of neurons that produce. Parkinson disease that results from the death of neurons that produce A, serotonin; B, acetyl choline; C, norepinephrine; D, dopamine. Parkinson disease that results from the death of neurons that produce. Given options: A, serotanin; B, acetyl choline; C, norepinephrine; D, dopamine. The right answer is option D, dopamine. Option D. Moving to question number 7. Most commonly used scale for depression is. Most commonly used scale for depression is. Given options: A, WAIS, WAIS; B, WISC, that is WISC; C, BPRS; D, HRSD. Most commonly used scale for depression is. The right answer is option D, HRSD. HRSD. Option D. Moving to question number 8. A rare condition in which separate personalities exist in the same person is called. A rare condition in which separate personalities exist in the same person is called A, dissociative identity disorder; B, split personality; D, schizophrenia; D, amnesia. A rare condition in which separate personalities exist in the same person is called A. Dissociative identity disorder, B. Split personality, C. Schizophrenia, D. Amnesia. The right answer is option A. Dissociative identity disorder. Option A is the right answer. Moving to question number 9. A person experiences both mania and depressive disorder episodes in dash disorder. A person experiences both mania and depressive disorder episodes in dash disorder. Given options. Option A, bipolar. Option B, unipolar. Option C, cyclothymia. Option D, amnesia. Again, I repeat the options. Option A, bipolar. Option B, unipolar. Option C, cyclothymia. Option D, amnesia. The right answer is option A, bipolar. Moving to question number 10. Which is used as a mood stabilizer in the treatment of mania and depression? Which is used as a mood stabilizer in the treatment of mania and depression? Given options: A. Lithium therapy, B. Antidepressant, C. ECT, D. Pharmacotherapy. Again, I repeat the options. Option A. Lithium therapy. Option B. Antidepressant. Option C. ECT. Option D. Pharmacotherapy. Which is used as a mood stabilizer in the treatment of mania and depression? The right answer is option A. Lithium therapy. Option A. Moving to question number 11. Obsessive compulsive disorders involve. Obsessive compulsive disorders involve A. Unresolved anger, B. Loss of contact with reality, B. Unresolved auditory conflict, D. High levels of anxiety. Again, I repeat the options. A. Unresolved anger, B. Loss of contact with reality, B. Unresolved auditory conflict, D. High levels of anxiety. The right answer is option D. High levels of anxiety. Moving to question number 12. Dopamine is a. Moving to question number 12. Dopamine is a. Given options: A. Neurotransmitter, B. Hormone, C. Disorder medicine, D. None of the above. Dopamine is a. Given options: A. Neurotransmitter, B. Hormone, C. Disorder medicine, D. None of the above. The right answer is option A. Neurotransmitter. Option A. Moving to question number 13. Who are the authors of TAT? Who are the authors of TAT? That is thematic apperception test. Who are the authors of TAT? Given options: A. Christina Morgan, B. Henry Murray, C. Charles Spearman, D. James Cattell. Option E, for your better understanding, option A and B. Who are the authors of TAT? The right answer is both A and B. That is Christina Morgan and Henry Murray are the authors of TAT. Moving to question number 14. Hearing voices that are not really, they would be called as. Hearing voices that are not really, they would be called as. Given options: A. Delusion, B. Hallucination, C. Auditory regression, D. None of this. Again, I repeat the options. Option A. Delusion. Option B. Hallucination. Option C. Auditory regression. Option D. None of this. The right answer is option B. Hallucination. Option B is the right answer. Moving to question number 15. Fear of enclosed places. A person having a fear of enclosed places. A. Claustrophobia, B. Zoophobia, C. Algophobia, D. Phyrophobia. Again, I repeat. The fear of enclosed places. Claustrophobia, B. Zoophobia, C. Algophobia, D. Phyrophobia. The right answer is option A. Claustrophobia. Option A. Dear viewers, I hope this post will be useful to you. I expect you to forward the link to your friends too. Together, let us grow. Kindly view fully the post for better understanding of all the posts. Already we have posted 12 practice tests and 10 educational psychology MCQs along with the current events in our channel. Do subscribe our channel. Thank you and have a great year ahead. Take care.